welcome to another episode of Kidney Health Dialogues. Dr. Sandeep, let's understand what are the misconceptions with respect to kidney diseases.
A lot of people come to us to asking whether kidney disease is hereditary, whether it can spread from one person to another in the family, and whether it is contagious, whether kidney disease can spread to one person to other. Hardly 5 to 8% or 5 to 10% of kidney diseases are hereditary. So rest all are our own sin. As I said, not maintaining blood pressure properly, not maintaining blood sugars well, not undergoing regular health checkup, not undergoing regular screening. These are the ways in which we generally get kidney diseases. 60 to 70% of times, kidney diseases are because of these things. And unnecessary intake of medication. This is also an important cause. But hereditary diseases, congenital diseases, these form hardly about 5 to 10% of general population. Next misconception is whenever we say, tell patients that they have got kidney failure, the common question which people ask us is, doctor, whether it is single kidney failure or double kidney failure, whether both the kidneys are failed or whether only one kidney has failed. See, whenever we talk about kidney failure, it means that both the kidneys have failed. Failed means they are functioning less. So whenever both the kidneys stop functioning or they function very less, only then person starts getting symptomatic. Even one kidney is more than enough for the functioning of the body. So whenever we mean to say kidney failure, it means both the kidneys have failed. The other thing which we commonly come across about dialysis. Many people think that once dialysis is started, it's always permanent. It is not so. Not in all cases. Only in cases where there is chronic kidney failure, there the dialysis is permanent. But there are cases where, as we discussed earlier, of acute kidney injury, that is, where there is a temporary shutdown of kidneys. In that case, even if there is a requirement of dialysis, it would be usually temporary. With a institution of good treatment and proper medications, early diagnosis, kidney functions can be recovered. So people need not worry that dialysis once started is always permanent. Once we get to know what is the proper cause of kidney disease and if it is treated properly, then kidney disease can be reverted.
Dr. Huilgol, we discussed many other aspects on with respect to kidney diseases, but what is the bottom line you want to give a message to the general public?
So the take-home messages, what I would like to say is, screening is very important. I mean, getting ourselves annual health checkup done is very important. As I said, kidney diseases are very asymptomatic. That is, there are no symptoms until and unless majority of kidney fails. Sometimes symptoms also do not appear. So screening is important. Even right from let us say age of about 25, 30, we have to start getting ourselves annual health checkup done. And in fact, those who have a family history of kidney diseases, those have to undergo annual health checkup compulsorily. And already who are diagnosed to have blood pressure and diabetes, they have to undergo regular health checkup and maintain their blood pressure and sugars in the normal range. For that, routine exercises and proper maintenance of diet and medications if necessary, it is very important. So screening for health conditions, screening for kidney diseases is very important, and by this we can find out whether they have got somebody has got kidney disease in the early stage and treat if necessary, and in this we can avoid kidney failure. So simple tests like urine examination, ultrasound scanning, then few blood investigations can tell us whether somebody has got kidney disease. And next, we have to avoid unnecessary medications. Unnecessary medicine intake, over the counter medicine intake has to be avoided. And the next thing I would like to say is, do not neglect seemingly minor infections. So by these things, we can have a very healthy kidney and a healthy life.